Hello, I'm Dr. C Gupta, heading the Department of Vascular and Endovascular Surgery, Interventional Radiology and Podiatric Surgery at Care Hospital in Banjara Hills. It's a group of specialists that provide comprehensive care to vascular and related problems under one roof. Now, one of the problems that men face is related to what we call the prostate. Now, prostate is a gland which surrounds the male urethra and has role in reproductive function. When it enlarges or becomes big, we call it benign prostatic hyperplasia or BPH. It can result in symptoms like increased frequency of urination, hesitancy or delayed passage of urine, a very thin stream of urine, inadequate emptying of bladder which can lead to urinary tract infection, and also we come across many patients who get up many times in the night to pass urine. These are all what we call prostatism or symptoms of benign prostatic hyperplasia. Now there are many ways to treat this. With me today is Dr. Santhosh, who is an interventional radiologist and specializes in a procedure that we call prostatic artery embolization. So before we go on to prostatic artery embolization, we'll just talk about what are the various ways to treat benign prostatic hyperplasia.
So as you were saying, it is relatively common symptom. Like at least 1 in 3 men over the age of 60 years will suffer from this problem. As the age increases, the incidence increases. Similarly, like approximately 1 in 2 men suffers from this problem above 80 years of age. So we can say that it is relatively a very common problem in the elderly age group. So traditional ways of treating it is like when the symptoms are mild, it can still be managed with medication alone. But if the symptoms become like moderate to severe, probably it needs surgical intervention. So as the imaging as well as the interventions are advancing, so now we are seeing newer modalities to treat this. That is one of which is called as prostatic artery embolization. In this, actually we don't cut and remove the prostate gland, but we target the blood vessels which are supplying the prostate and block them. So that over a period of time the gland shrinks and the compression over that urethra comes down and the symptoms will be relieved.
I remember in the olden days, the typical surgery for prostate was an open surgery and a fairly morbid surgery leading to a fair number of complications and quite a painful procedure. As time went by, procedures became, let's say, easier on the patient and the surgeon. So we started doing what we call TURP or transurethral prostatic resection. So there an endoscope is inserted through the urethra, again no cuts outside. And now a lot of surgeons are using what we call laser or a laser prostatectomy. So the recent advance is prostatic artery embolization, where you actually don't remove or cut the prostate. So who are the ideal patients who would benefit from prostatic artery embolization rather than surgery?
So even though the minimally invasive procedures, surgical procedures like TURP and laser prostatectomy, they still require general anesthesia. One. Second thing, most of these patients will be having some comorbidities like cardiac or neuro issues where they use antiplatelets and all. So and because of the underlying comorbidities as well as the drugs, they become high risk candidates for the traditional surgeries. So in those patients, especially who are suffering with symptoms and an enlarged gland, PAE can be offered, that is prostatic artery embolization, where we don't need the patient to undergo general anesthesia. It can be done like a minimally invasive procedure under local anesthesia, where patient will be completely awake during the procedure and patient is discharged on the same day and with very minimal complication risk. We can say actually there are no complications per se in the procedure.
I think if the procedure is done well, we can really avoid complications.
Yes.
But again, done by untrained people, it can be a disaster.
Yes.
That's if, do I get that right?
Yes. Yeah. Non-target embolization, one of the risks where we have to identify the branches which are supplying other than the prostate meticulously, then only we will be able to achieve good results without any complications.
Yeah. So it's a very, very specialized procedure, not for every Tom, Dick and Harry. A doctor really needs to be well trained in doing this very, very specialized procedure. And I think the ideal candidates, as you mentioned, are especially cardiac or vascular patients who are on blood thinning medication, and the blood thinning medication cannot be stopped. And when this medication cannot be stopped, obviously they cannot undergo surgery, and then prostatic artery embolization becomes the ideal procedure. Now, how does embolization help these patients in getting rid of symptoms?
So here what we do is we go selectively into the artery which is only supplying the prostate. So we identify it on angiogram. So we embolize that particular artery which is supplying the prostate. So over a period of time, the blood supply to the prostate comes down. So the gland shrinks. So size of the gland shrinks over a period of time, like typically around 1 to 3 months. So once the gland shrinks, then the symptoms, the compression symptoms over the urethra decreases and the patient will get good symptomatic relief.
Yeah. So if I were to just explain, so the prostate is supplied by the prostatic artery, which provides this nutrition and also the ability to grow, and actually sometimes grow out of proportion,
Yes.
resulting in symptoms of BPH. So just like a person goes on diet and becomes thin, similarly when we cut off the blood supply to the prostate, it shrinks in size and thereby helps in relieving the symptoms. So anything you would like to say in terms of let's say the feasibility and the benefit, real benefit that the patient can have from this procedure?
Yes. So one more thing which I want to discuss is, like, since whatever TURP or laser prostatectomy, it has to be done transurethral route. So inherent complications, or we can say consequences of the procedure, are like sexual dysfunction as well as urinary incontinence. So who are like whichever patient who still wants a good sexual life and doesn't want urinary incontinence can still opt for prostatic artery embolization instead of traditional procedures like TURP or prostatectomy. So this is one advantage of PAE, where these complications or consequences will not be there.
I think that's a major advantage, because I know of a urology friend who told me that they have devised a new way to do a TURP or a transurethral resection of prostate, whereby they can actually preserve the sexual function or the ejaculation. But then we don't have many people who are actually trained to do that, and therefore this procedure becomes really a very good procedure for patients who are suitable for this. Again, get it done by a person who is trained in this procedure so that you don't end up with problems. Thank you, Dr. Santhosh.
Thank you, sir.
Thank you.